Let's get a quick take on this final topic. The Colorado Health Exchange is making headlines again this week as House Republicans propose the bill to repeal the insurance program. This comes on the heels of a report that more than 3,600 plans have been canceled due to design malfunction on the exchange's website. Penn, what's your quick take?
Well, history has shown us that this is not a perfect bill, neither is the Affordable Care Act, but I think most people feel it's better than the alternative. And the problem in Colorado, and the reason the Bill 1066 was killed in committee yesterday, is because Republican legislators who put it forward had no alternative to the exchange. And when you have 121,000 people already enrolled in health insurance through the exchange, you better have an alternative before you scrap what's there.
Susan, your thoughts on both of the proposal and obviously how it died in committee?
Yeah, well, legally, the alternative is the feds take it over, so I don't think that's really ideal for Republicans either. And I also think the numbers are interesting here. The 3,600 out of 121,000 is less than 3%, and that's actually an inflated number because open enrollment is still open until February 15th. So this is not like an epidemic of glitches here. This is a hugely complicated new program. It's only a year old. You know, Rome wasn't built in a day, and I think if you look at it statistically, the glitches are fairly minor.
Patty, Rome wasn't built in a day, but this viaduct has had its own issues. What do you think?
Well, Colorado was fast out of the gate to set this up, and I'm glad we set it up so that we are not at the mercy of the feds on it. But I don't think the repeal of Connect for Health will go through, but I do think probably the measure that would like to put an end to the bonuses for the people who run it, that may see a lot of support this year.
And the audit. I mean, everybody kind of agrees it's new, it should be, there are glitches. Right. There's no private business that would say no to an audit, and so Democrats and Republicans basically agree there's room for it here.
David, wrap it up for us.
As the Huns showed, it only takes one day to burn Rome to the ground. And that's what happened on the day that BFD, as Joe Biden put it, Obamacare was signed into law. It took a flawed system and made it much worse. It moves in the direction of taking choices away from people, herding them like cattle and automatons into these very narrow set of available plans. What we need is more health care freedom, much greater ability for people to choose the plans that are right for them.
I think somehow I knew that Rome thing was going to come right around the barn.